intake was tracked over 10 years, between 1998 to 2009, and was published in JAMA. So the study looked at resveratrol in Italians over 65 and looking at what happened to these people. Now, less than 1% of the population took vitamins, minerals, herbs. They're not so addicted as us Americans are, luckily for them, because we know the data. So the researchers could be pretty sure that the byproducts of resveratrol were from food and drink, not from pills. And you'd expect that. This was in Italy's most prolific wine-producing regions, Chantilly region, where red wine is a regular feature for most people. So there were 783 men and women, and about a third of the people died over 9 years. 27% of those healthy to begin with developed heart disease, and 4.6% developed cancer. But whether the study participants consumed resveratrol or not, the study revealed there was no difference in the rate of cancer, heart disease, death, or inflammation. The study was led by a doctor from Johns Hopkins. Most of the people that were in the Chantilly study were aging but healthy and taking resveratrol in a normal way. Food, diet did not help. So this casts doubt on this whole idea of French paradox that you can eat whatever you want and the red wine will negate it. No, people that take more red wine in Italy or not have the same cancer rate and death rate, and we're going to have to focus on other things, mainly stopping smoking and getting your checkups, seeing your doctor. Resveratrol is not going to be, it appears, the magic bullet. I believe we have a caller from New York City, so let's go ahead and take that.
Hello.
Hi, it's Dr. Lederman. How are you?
Fine. My name is Hubert, and I hear a lot about Dr. Haas's CyberKnife, and I'd like to know if you do know, what is the difference in the treatment of CyberKnife and your treatment?
Well, first of all, we've actually just presented the data here showing that people that have CyberKnife treatment have higher complication rates. So issue number one is complication rates. Actually, I have the paper in front of me. The paper was just published in the Journal of Clinical Oncology, which is one of the major cancer journals, and it was written by Charlotte Bath. And she wrote a retrospective analysis of patients with prostate cancer receiving primary treatment with CyberKnife or other methods of radiation, found those receiving CyberKnife treatment had a much higher rate of genitourinary toxicity within the 2-year follow-up. And the authors wrote, quote, "The increased toxicity was present at all time points and indicated an increase in both acute and later toxicity. This increase was largely associated with higher rates of urethritis, urethral strictures, urinary incontinence, obstruction among patients receiving CyberKnife therapy." It was written in the Journal of Clinical Oncology. So the main problem with CyberKnife therapy is, rather than investigating the treatment before they offered it to the general public, they didn't do that. They offered it to the general public first, without any preliminary studies, long-term studies, and even to this day, there's only about 200 patients out at 5 years with CyberKnife treatment, compared to just me. That's with all the patients in the hundreds of facilities across America. Compared to just me, I have 3,000 patients. So it's been poorly studied. It's been offered to people, I believe, for hospitals to make money, not to provide better care, and they don't have the results. So for me with prostate cancer, I would want to go to a facility that has data, long-term data, experience, that can show you how the results will be, not promise pie in the sky. So it's a very simple matter.
So this, so the 5-day treatment that they give, how does that? Well, you said how it compares, which shows there's no study, but does your treatment take longer than 5 days, or it depends on?
Well, first of all, look, and we're talking about prostate cancer only. So if you want the quickest treatment, we can give you treatment in 45 minutes. One treatment in 45 minutes. You can come in, have brachytherapy. It's one treatment, 45 minutes. It's proven over 25 years. You want the fastest treatment? We offer it. It is not CyberKnife.
Okay, but now it's better over a longer period, though, isn't it?
What's that again?
Well, you said you can do it in 45 minutes as opposed to 5 days. But what is the better way of doing it? Is it 45 minutes?
Look, excuse me. Every patient is different, and I say this every week. Mm-hmm. You can't cut corners. And for people who try to get 2 minutes with the doctor on the phone to get the answer, that's not how you do it. You know, some people have high Gleason scores. Some people have high PSA. Some people have low scores. Some people want a quick treatment. Some people want the best treatment. And they're not always the same. And so people that just focus on these 5 treatments don't understand prostate cancer isn't one disease. It's many diseases. And there's not one answer. I'm just telling you, for example, if you want the fastest treatment, we offer the fastest treatment. You come in at 7 o'clock in the morning, you'll be done by 8 o'clock. That's it. One treatment, the end, prostate cancer, finished. So there's many different ways, and just on the phone is the wrong way of doing it. If you're serious about this, make an appointment, come in, we'll spend an hour or 2 hours and go over all the data. CyberKnife doesn't have data. It does not have long-term data. There's data that I just presented to you that showed CyberKnife has much higher toxicity. It's not the fastest treatment. It's not the cheapest treatment. Maybe it's the most unproven treatment. And I don't think that's what men with prostate cancer want. Men, in my experience with prostate cancer, want the highest chance of being cancer-free, avoiding radical surgery, keeping sexual life, and keeping urinary life.
Okay. I understand what you're saying, and I'll give you a call.
All right. Thank you, and God bless you.
All right. Thank you.
All right. Thank you for calling in today.
All right. Bye.
Okay, so we just spoke about CyberKnife again, and again, if you have prostate cancer, I would encourage you very strongly to make an appointment, come in before you get treatment somewhere else. We talked about the gentleman who had treatment elsewhere with standard radiation. He now has back pain, mental status changes, he's on hormonal therapy. We're trying to straighten him out, but it's a lot harder to straighten out after something's been done than to start at the beginning. So if you have prostate cancer, or in fact any cancer, give us a call. That's all we do. We're a cancer treatment center, and we specialize in cancer treatment of all sorts. So there's not one answer, and there can't be one answer for everyone. It's like people that go to certain facilities that have one game, whether it's CyberKnife for prostate or proton beam. No. There's many options for every person. Men with prostate, we talked about women with breast cancer, every disease. There's options. There's always options, and you should learn all the options beforehand. If you've already had treatment and you're having problems, give us a call. We will try to sort it out. Again, the best thing is to come in person and spend a while. I used to think that it was the doctors that try to cut corners on patients and not give the patient all the time they need. But actually, I now see that it's often the patient that tries to cut corners. They try to spend 2 minutes to get an answer when it's not a 2-minute answer. It may be an hour answer, maybe 2 hours answer. We may be sending our staff to chase down records from 10 different places, and that's what we do every day. We think we're different. We don't have to see 1 million patients a day. We're a private cancer treatment center. We don't take money from the drug companies. We don't take money from the surgeons. We don't have a president of a hospital that makes $20 million a year like one of the presidents in the New York area made last year, $20 million. Where did he get his $20 million from? Well, he got it from the patients that went there, right? We don't do that. So I want to talk about some other cases and some other news. So the next patient I want to talk about is a woman that came to us with lifelong diabetes. She's 65. She had diabetes for 58 years. She has heart disease. She has breast cancer, and she was ignoring the breast cancer to take care of the heart disease. Well, her heart was pretty good. She had a stress test. She had an ejection fraction, which is how much of the heart blood gets pumped. So let's say you have 100 cc's of blood in your heart. Each time the heart beats, it pumps out 65% of it. It's like the efficiency of a pump, and that's really what the heart is. It's a fancy pump. Well, in her stressed period, that efficiency went down to 45%. So it went from 65 to 45, and she got all alarmed. And then she heard about us, and she heard about us mainly because she was having terrible pain. So she had breast cancer. She ignored it for the heart. And sometimes you can't ignore things. It's like if you're living in a house and you have a tiger in the front door and a lion in the back door, you better take care of both the tiger and the lion, or you're not going to be around a long time. So she came to us. She had terrible pain. Again, we got her staged up within a day. The same day she came to us, she finally got staged up to know where the cancer is. We found very extensive cancer in her spine. We gave her just 5 treatments to the spine in the stereotactic frame. Remember, we were the first in America, the first in the Western Hemisphere to offer radiosurgery, which is non-invasive treatment. She got these 5 treatments. By the second treatment, she was better, and now pretty much the pain has gone away in that area. She's happy. She understands that she's fighting both diseases. The heart is probably even secondary to the cancer. We started on some hormone pills. She does not want chemotherapy. So she got focused radiation. She got hormone pills starting. So the cancer-related pain went away with just the focused radiosurgery. She's going to take some time off to breathe a little bit, and then she'll be back to talk about further treatment, if necessary, with us at 38th and Broadway. So, at that point, we again are going to take a short breather, hear a couple of voices. Remember, we're taking your calls. You can call us at 212-CHOICES, which is 212-246-4237. We have booklet and DVD, which we're happy to send to you at no charge. It explains our work. But again, every case is different, so no booklet can really tell you what is your specific issues. Only sitting down and talking can do that. So we're going to listen to words from a few new voices, and then we'll be back to take your calls, talk about cases and new news. Here we go.
For cancer treatment, most prefer effective, non-invasive, well-tolerated outpatient therapy. With Dr. Lederman, the radiosurgery pioneer, that's our goal too. He's first in America, first in New York, first for you. With Body Radiosurgery, we hit your cancer with no cutting, no bleeding. Dr. Lederman has decades of experience with primary and metastatic, large or small cancers from head to toe. Cancer treatment with possibly a second chance for you, even if chemo, radiation, or surgery didn't work or isn't tolerated. Our goals are best results and quality of life. Meet Dr. Lederman to hit the cancer. For a free booklet DVD, call 212-CHOICES, 212-CHOICES for a fresh second opinion. Most insurances, Medicare, Medicaid accepted. Not only super convenient, super Broadway and 38th in Manhattan. To hit your cancer, see Dr. Lederman, 212-CHOICES, 212-CHOICES.
With Dr. Lederman, the best prostate cancer treatment is custom tailored for you. Each man with prostate cancer is unique and seeks the best results based on PSA, Gleason score, and stage. That's why Dr. Lederman's custom-tailored prostate cancer treatment is most logical. Not every man should get the same treatment. Dr. Lederman's custom prostate cancer treatment is all outpatient. Our goals are your best results, avoiding radical surgery, maintaining your sexual and urinary function, and your